Did you know that a single quiet change in your body, something so small you might ignore it, could be the difference between catching cancer early or finding out when it's already too late? Here's a question most people never ask themselves. What if the warning signs were already there, but you didn't recognize them? What if your body tried to alert you weeks, months, or even years in advance, and the message went unnoticed? Every day, millions of people brush off subtle symptoms, assuming they're just part of aging, stress, or a normal health issue. But what if some of those signals were actually your body asking for attention? Statistics show that 1 in 3 people will develop cancer at some point in their life. That's not meant to scare you, but it should make you curious. Why do some people catch it early and recover, while others only find out when options are limited? Is it bad luck, or is it awareness? And more importantly, would you know the difference if it happened to you? You might be wondering, should I worry about every ache, every change, every strange feeling? Or how do I know what matters and what doesn't? These are fair questions, and the answers may surprise you. Many of the most dangerous warnings don't look dramatic. They don't come with sharp pain or emergency symptoms. They arrive quietly, blending into daily life, waiting to be ignored. In this video, you will learn 8 early warning signs of cancer that could truly save your life. We rank them from less to more critical signs. These are not the obvious symptoms you hear about all the time. They're subtle changes in your body, signs that often appear before the disease becomes serious. Before we get into it, can you do us a quick favor? Like this video and subscribe to join our healthy community. Also type yes in the comments section now, so we can see how many of you are interested in this type of video. All right, let's get started. Number 8, unexplained night sweats. Occasional night sweats can be completely normal. A warm room, heavy blankets, spicy food, stress, hormonal changes, or even a mild infection can all cause you to wake up feeling sweaty. But there is a very important difference between normal night sweating and unexplained, severe night sweats. The kind that soak your clothes, drench the sheets, and force you to change in the middle of the night. When night sweats are intense, persistent, and happen repeatedly without an obvious reason, they should never be ignored. In a medical context, these severe night sweats are strongly associated with lymphoma, a type of cancer that affects the lymphatic system. Doctors often refer to this symptom as part of what are called B symptoms. These include 3 key warning signs: drenching night sweats, unexplained weight loss, and persistent fever. When these symptoms appear together, they raise significant concern and often prompt further investigation. What makes cancer-related night sweats different is their intensity and consistency. They are not mild. People often describe waking up completely soaked, as if water had been poured over them. These episodes can happen night after night, regardless of room temperature or bedding. Alongside the sweating, many individuals experience extreme fatigue, weakness, and weight loss despite no change in diet or activity level. Scientific research supports this connection. A large clinical review published in 2015 in the Journal of Clinical Oncology confirmed that B symptoms, including severe night sweats, are common early indicators of lymphoma and are linked to disease activity and progression. The study emphasized that patients reporting persistent night sweats were more likely to have an underlying systemic condition requiring urgent evaluation. It's important to understand that night sweats alone do not automatically mean cancer. However, persistent, unexplained night sweats are never something to brush off, especially when they occur frequently or are accompanied by fever, fatigue, or weight loss. Too many people dismiss them as stress, aging, or hot weather, and delay seeing a doctor. Your body does not create symptoms without a reason. If night sweats are intense, recurring, and unexplained, they are your body's way of signaling that something may be wrong. Getting medical attention early can make a critical difference, because when conditions like lymphoma are detected early, treatment outcomes are significantly better. Number 7, persistent heartburn. Heartburn is something most people experience at least once in their lives. It often shows up after a heavy meal, spicy food, coffee, or eating too late at night. For many, it's uncomfortable but temporary. However, when heartburn becomes persistent, lasting for weeks or even months, it should no longer be considered normal. Ongoing heartburn can be a warning sign of a deeper problem. one that deserves serious attention. Persistent heartburn is most commonly linked to chronic acid reflux, also known as gastroesophageal reflux disease, GERD. In this condition, stomach acid repeatedly flows back into the esophagus, irritating and damaging its lining over time. This repeated exposure to acid can lead to inflammation, scarring, and cellular changes that raise cancer risk. One of the most concerning outcomes of long-term acid reflux is a condition called Barrett's esophagus, in which the normal lining of the esophagus changes to resemble intestinal tissue. Barrett's esophagus is considered a precancerous condition and significantly increases the risk of developing esophageal cancer. According to a major study published in 2014 in the New England Journal of Medicine, individuals with chronic GERD and Barrett's esophagus had a substantially higher risk of esophageal adenocarcinoma compared to the general population. The study emphasized that persistent reflux symptoms should never be ignored, especially when they occur regularly over long periods. There are also additional warning signs that heartburn may be something more serious. These include difficulty or pain when swallowing, a sensation that food is getting stuck in the throat or chest, chronic coughing, hoarseness, chest discomfort unrelated to exercise, and unexplained weight loss. These symptoms suggest that the esophagus may already be significantly irritated or damaged. Many people rely on over-the-counter antacids or acid-reducing medications for quick relief. While these can help manage symptoms, they do not address the underlying cause when heartburn is persistent. If lifestyle changes, such as avoiding trigger foods, eating smaller meals, losing weight, or elevating the head during sleep, do not improve symptoms, medical evaluation is essential. Doctors may recommend diagnostic tests like an endoscopy, which allows direct visualization of the esophagus and early detection of abnormal tissue changes. When caught early, conditions like Barrett's esophagus and esophageal cancer are far more treatable. Persistent heartburn is not just discomfort. It can be an early warning sign that could save your life if taken seriously. Number 6. Jaundice. Jaundice is a condition marked by a yellow tint of the skin and the whites of the eyes. It occurs when bilirubin, a yellow pigment produced during the normal breakdown of red blood cells, builds up in the bloodstream. Under healthy conditions, bilirubin is processed by the liver and excreted through bile. When this process is disrupted, bilirubin accumulates, leading to the visible yellowing known as jaundice. There are many non-cancerous causes of jaundice, including hepatitis, gallstones, infections, or certain medications. However, when jaundice appears suddenly, without a clear explanation or progresses rapidly, it can be a critical warning sign of something more serious. One of the most concerning causes is blockage of the bile ducts, which can occur due to pancreatic cancer or liver cancer. In pancreatic cancer, tumors often develop near the bile duct, compressing it and preventing bile from flowing normally. As a result, bilirubin backs up into the bloodstream. In fact, jaundice is frequently one of the earliest noticeable symptoms of pancreatic cancer, especially when the tumor is located in the head of the pancreas. Liver cancer can also impair bilirubin processing directly by damaging liver tissue. Jaundice is rarely an isolated symptom. It is often accompanied by other noticeable changes, including dark-colored urine, pale or clay-colored stools, persistent itching, unexplained weight loss, nausea, and upper abdominal or back pain. These symptoms occur because bile is no longer reaching the intestines properly, affecting digestion and waste elimination. Scientific evidence strongly supports the importance of jaundice as an early red flag. A comprehensive clinical review published in 2018 in the Lancet Gastroenterology and Hepatology reported that painless jaundice is one of the most common early presenting symptoms of pancreatic cancer. The study emphasized that patients who sought medical care promptly after noticing jaundice had significantly higher chances of earlier diagnosis and better treatment options. It's crucial to understand that jaundice does not automatically mean cancer. However, sudden, unexplained jaundice, especially when paired with dark urine, pale stools, or abdominal discomfort, should always be treated as a medical emergency. Delaying evaluation can allow serious conditions to progress silently. Doctors can quickly investigate jaundice through blood tests, imaging scans such as ultrasound or CT, and liver function tests. When the underlying cause is identified early, treatment can begin sooner, and in cases of cancer, early detection can dramatically improve survival outcomes. Jaundice is your body's visible warning light, and it should never be ignored. Number 5. Persistent bone pain. Occasional aches and pains are a normal part of life, especially as we age or after physical activity. Muscles get sore, joints stiffen, and minor injuries can cause temporary discomfort. However, persistent deep bone pain is very different from common aches, and when it lasts for weeks, worsens over time, or feels especially intense at night, it can be a serious warning sign that should not be ignored. Cancer-related bone pain often has distinct characteristics. It is usually deep, dull, or throbbing, and unlike muscle pain, it does not improve with rest, stretching, or over-the-counter painkillers. Many people report that the pain becomes worse at night or wakes them from sleep. This happens because cancer can disrupt normal bone structure, increase pressure inside the bone, and irritate surrounding nerves. There are two main cancer-related causes of persistent bone pain. The first is bone metastasis, which occurs when cancer from another part of the body, such as breast, prostate, lung, or kidney cancer, spreads to the bones. The second is primary bone cancer, such as osteosarcoma, which originates directly in the bone. While primary bone cancers are rarer, they often present with localized pain that steadily intensifies. Additional red flags can include swelling or tenderness over a specific bone, unexplained fractures from minimal injury, reduced mobility, and weakness in the affected area. Because cancer can weaken bone structure, fractures may occur from activities that would normally be harmless, such as standing, walking, or light lifting. Scientific evidence highlights the importance of recognizing these symptoms early. A large clinical study published in 2017 in the Journal of Bone Oncology found that persistent bone pain was one of the most common early presenting symptoms in patients with bone metastases. The study emphasized that early evaluation of unexplained bone pain led to earlier diagnosis and improved pain control and treatment outcomes. It's important to note that most bone pain is not caused by cancer. Arthritis, injuries, vitamin deficiencies, and infections are far more common explanations. However, persistent bone pain that does not improve, worsens at night, or is associated with swelling or fractures should always be evaluated by a healthcare professional. Doctors may use imaging tests such as X-rays, MRI, CT scans, or bone scans to identify the cause. Blood tests may also reveal markers of bone breakdown. When detected early, many cancers affecting the bones can be treated more effectively, reducing pain and preventing serious complications. Persistent bone pain is not something to push through. It's a signal your body wants you to investigate. Number 4. Unusual skin rashes. The skin is not just a protective barrier, it is also a mirror of what's happening inside the body. Many people assume rashes are caused by allergies, heat, or minor infections, and in most cases that's true. However, certain unusual skin rashes can signal serious internal conditions, including blood-related cancers. Knowing how to recognize these warning signs can make a critical difference. One particularly concerning type of rash involves tiny red or purple spots called petechiae. These spots are caused by bleeding under the skin and have a key distinguishing feature. They do not fade or turn white when pressed. Unlike common rashes or insect bites, petechiae are not raised and do not itch. They often appear on the legs, arms, or inside the mouth and may spread over time. Petechiae are frequently linked to low platelet levels, a condition known as thrombocytopenia. Platelets are essential for blood clotting, and when their levels drop, small blood vessels can leak, causing these pinpoint spots. One of the most serious causes of low platelets is leukemia, a cancer of the blood and bone marrow that disrupts normal blood cell production. Unusual rashes related to leukemia rarely appear alone. They are often accompanied by unexplained bruising, frequent nosebleeds or gum bleeding, extreme fatigue, pale skin, and recurrent infections. Because leukemia affects white blood cells, the immune system becomes weakened, making infections more common and harder to fight off. These combined symptoms can develop quietly and worsen over time if left untreated. Medical research supports the diagnostic importance of skin changes. A clinical study published in 2016 in the Journal of the American Academy of Dermatology reported that cutaneous manifestations, including petechiae and unexplained bruising, were among the early presenting signs in a significant number of leukemia patients. The study emphasized that early recognition of these skin findings often led to faster diagnosis and earlier treatment. It's important to understand that not every rash or bruise indicates cancer. Infections, medications, vitamin deficiencies, and autoimmune conditions can also affect the skin. However, persistent, unexplained rashes, especially those that don't fade with pressure or appear alongside bleeding and fatigue, should never be ignored. Your skin can provide valuable clues about your internal health. Paying attention to unusual changes and seeking medical advice early can lead to life-saving diagnoses. When it comes to unexplained rashes, it's always better to investigate than to assume they'll simply go away. Number 3. Persistent or recurrent fever. A fever is one of the body's most common defense mechanisms. It usually appears when the immune system is fighting an infection, such as the flu, a cold, or a bacterial illness. In most cases, the fever resolves within a few days and improves with rest or treatment. However, a fever that lasts longer than 2 weeks, keeps returning without a clear cause, or does not respond to medication should never be ignored. Persistent or recurrent fever can be an early warning sign of blood cancers, particularly leukemia and lymphoma. In these conditions, abnormal blood cells interfere with normal immune function, triggering ongoing inflammation and immune responses that lead to repeated or prolonged fevers. Unlike infection-related fevers, these tend to come and go without a clear pattern and may not be accompanied by typical cold or flu symptoms. Cancer-related fevers often occur alongside other systemic symptoms. Many people experience night sweats, unexplained weight loss, constant fatigue, and a general feeling of weakness. These symptoms are part of what doctors refer to as B symptoms, which are commonly associated with lymphoma and can signal active disease even in early stages. Because these signs can appear gradually, they are often mistaken for stress, overwork, or minor illness. Scientific evidence strongly supports the link between unexplained fever and blood cancers. A comprehensive clinical review published in 2013 in the New England Journal of Medicine examined cases of fever of unknown origin and found that hematologic malignancies, including leukemia and lymphoma, were among the most common serious underlying causes. The study emphasized that persistent fever without an identifiable infection warrants thorough medical evaluation. It is important to note that many non-cancerous conditions can also cause prolonged or recurring fevers, such as autoimmune diseases, chronic infections, and inflammatory disorders. However, what sets cancer-related fevers apart is their persistence, lack of response to standard treatments, and association with other unexplained symptoms. Doctors may investigate recurrent fevers with blood tests, imaging scans, and sometimes bone marrow studies to determine the cause. Identifying the source early can dramatically improve treatment options and outcomes, especially for blood cancers that respond best when diagnosed at an early stage. Your body is designed to warn you when something is wrong. When a fever keeps coming back or refuses to go away without explanation, it may be more than just an infection. It could be your body sounding an alarm that deserves immediate attention. Number 2, changes in fingernails. Your fingernails may seem like an unlikely place for serious health warnings, but they can reveal important clues about underlying disease. While nail changes are often caused by minor injuries, infections, or aging, certain nail abnormalities should never be ignored, especially when they appear suddenly or continue to change over time. One of the most concerning signs is a dark vertical streak running under a fingernail or toenail that does not fade, move, or grow out as the nail grows. This can be a warning sign of subungual melanoma, a rare but highly aggressive form of skin cancer that develops in the nail matrix. Unlike typical melanomas linked to sun exposure, subungual melanoma can occur in areas not exposed to sunlight, which is why it is often overlooked or misdiagnosed. Another major red flag is pigment spreading beyond the nail onto the surrounding cuticle or skin, a feature known medically as Hutchinson's sign. This outward spread suggests that abnormal pigment-producing cells are extending beyond the nail structure, increasing the likelihood of malignancy. The affected nail may also become brittle, split, or lift away from the nail bed over time. These nail changes are frequently mistaken for bruises, fungal infections, or trauma from everyday activities. Many people assume the dark streak will disappear on its own, but unlike bruises, cancer-related pigment does not move forward with nail growth. This delay in recognition is one reason subungual melanoma is often diagnosed at a later, more dangerous stage. Scientific research underscores the importance of early detection. A comprehensive review published in 2014 in the Journal of the American Academy of Dermatology found that subungual melanoma was frequently misdiagnosed, initially leading to delayed treatment and poorer outcomes. The study emphasized that early identification and surgical intervention significantly improve survival rates. It's important to remember that not every nail streak is cancer. Benign conditions such as moles, ethnic pigmentation, medications, or trauma can also cause discoloration. However, new changing or unexplained nail pigment, especially if it darkens, widens, or spreads, should always be evaluated by a dermatologist. A dermatologist can assess nail changes using dermoscopy and, if necessary, perform a biopsy to confirm the diagnosis. When detected early, subungual melanoma is far more treatable and less likely to spread. Your nails may seem small, but paying attention to subtle changes could play a critical role in protecting your health and even saving your life. Number 1. Persistent eye pain or vision changes. Eye discomfort is often blamed on fatigue, dry eyes, screen exposure, or aging, and in most cases, that assumption is correct. However, persistent eye pain or unexplained changes in vision should never be ignored, especially when symptoms do not improve with rest or standard treatment. In rare cases, these signs can point to ocular melanoma, a serious cancer that develops in the pigment-producing cells of the eye. Ocular melanoma most commonly affects the uvea, the middle layer of the eye, and unlike skin melanoma, it is not related to sunburn in an obvious way. Because the eye lacks pain receptors in many areas, this cancer can grow silently for a long time before symptoms appear. When warning signs do emerge, they are often subtle and easy to dismiss. Common red flags include blurred or distorted vision, unexplained flashes of light, the sudden appearance of floaters, partial vision loss, or a dark spot on the iris that changes in size, shape, or color. Some people experience a shadow or curtain-like effect across their field of vision. In certain cases, persistent eye pain or pressure may develop as the tumor grows and affects surrounding structures. One of the dangers of ocular melanoma is delayed diagnosis. Because symptoms may seem mild or unrelated, many people postpone seeing a specialist. Scientific evidence highlights the importance of early detection. A large population-based study published in 2016 in Ophthalmology, the Journal of the American Academy of Ophthalmology, found that tumors detected during routine eye exams were significantly smaller and associated with better survival outcomes compared to those diagnosed after symptoms became severe. The study emphasized that regular eye examinations play a crucial role in identifying ocular melanoma before it spreads. It's important to understand that most vision changes are not caused by cancer. Conditions such as cataracts, glaucoma, infections, or retinal problems are far more common. However, persistent or progressive symptoms, especially when they affect only one eye, should raise concern and prompt evaluation. An ophthalmologist can detect early signs of ocular melanoma through a comprehensive eye exam, including retinal imaging and ultrasound if needed. When caught early, treatment options such as radiation therapy or targeted procedures can preserve vision and significantly improve survival. Your eyes are not just windows to the world, they are windows to your health. If eye pain or vision changes persist, do not wait or self-diagnose. Seeking prompt medical attention could protect your sight and, in rare cases, save your life. To wrap things up, your body has powerful and intelligent ways of warning you when something isn't right, but only if you're willing to listen. Subtle changes like persistent discomfort, unexplained symptoms, or shifts you can't clearly explain are often the body's earliest signals that something deeper may be happening. Too often, these signs are brushed off as stress, aging, or minor issues when in reality they deserve attention. The symptoms we discuss today may seem small on their own, but together they remind us of one critical truth. Early action saves lives. Catching serious conditions early, including cancer, dramatically improves treatment options and outcomes. That's why awareness matters. Not fear, but knowledge, observation, and timely medical care. If you've noticed any of these warning signs in yourself or someone you love, don't ignore them. Getting checked early can bring peace of mind, or make all the difference when it matters most. Thanks for being here and taking the time to learn how to take better care of yourself. And if you want to keep going, we've got more content lined up to help you look and feel your best. Click on one of the videos on screen and we'll see you there.